get some antibiotics?
Yes, I am.
All right. Well, you need you to come and do a registration here.
Hi, I'm Brianne. Nice to meet you.
Do you mind if you sign your last and first name for me?
Sure.
And we're going to ask you a few questions about what you might or might not be allergic to make sure we get you the right antibiotic. Okay, so we'll get started. Do you happen to know if you're allergic to doxycycline, tricycline, or any of the cycling drugs?
I don't know. I've never really had any drugs like that before. I don't know.
Have you ever taken antibiotics before that you know of?
No.
Do you happen to know if you're allergic to any medication?
No. Can you explain the medication?
Well, do you take any medications?
I do.
Has a doctor or a nurse ever told you that you're allergic to anything?
It's been a while, no.
Have you ever taken a medication that might have given you a rash or hives or made it difficult to breathe?
I don't remember. Don't remember anything.
Okay, so what we're going to do, Brianne, is we're going to have a medical consult, which means a nurse practitioner or a doctor come over and ask you a few more questions just to make sure we give you the right medication.
Hi, Brianne. I'm Tom. I'm a doctor.
Hello.
Okay, so I've been called. I think that the team has some questions. Okay.
So Brianne isn't sure if she's allergic to any of the medications we have today, either doxycycline or ciprofloxacin. She's just not certain whether she does or doesn't have an allergy.
So, Brianne, I just want to ask you some additional questions. Do you have allergies to any medicines?
Not that I remember. I'm not really sure.
Okay. Have you ever been told that you had allergies to medicines?
No.
No. Have you ever taken any medicines and then had maybe a really bad reaction and then they told you can't take them anymore?
No.
No? Okay. All right. So, in general, doctors have given you medicines and you've been able to take them?
Yes.
Okay. All right. So, I'm going to suggest, would you agree that you don't know that you have any allergies to medicines? Do you know if you've ever taken doxycycline before?
I don't remember, no.
Okay. And do you remember if you've ever taken ciprofloxacin or other fluoxetine drugs?
Not that I can remember. It's just I can't think of anything.
Okay. All right. Do you have a medical card with you or any information that, for when you go to a doctor or go to the hospital? Do you have a card that you give that gives information about yourself?
Yes.
Do you have it with you?
Yes.
Can we see it?
Sure. This is what I have.
Hi, how are you doing?
Okay. So these are the medicines, and there's no mention of any drug allergies. Okay. So, Brianne, I'll just ask you again. Are you aware that you have any drug allergies?
I don't know.
Don't know. Okay. I think that we can. We don't have any clear report that she's allergic to doxycycline, and so I would take that as being a non-allergic.
Okay.
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 All right.
Great, thank you, Tom. Brianne, just one more question. When you take your medications, do you take them in pill form? Can you swallow pills?
Yes, I can.
Okay, great. So we're going to give you some information on how to take doxycycline.
Okay.
And we'll put it in a little bag for you.
Okay, thank you.
Thank you.
All right, so here's your prescription, okay? And I'm just going to put this in this bag, along with the screening form that we use, and also with some information on how to take the medication, or if anything goes wrong, or if you just have questions and want to know more about it. So you can find all that information here, okay?
Okay.
So I'll also put that in the bag for you. And then what you can do next is you go to you see this tent here? At the end of that tent, there's a table called the swag table. And you can turn this in and exchange it to get a gift.
Okay, thank you
Brianne,
so
just
much.
one more little thing. So just because you're not 100% sure whether you may or may not be allergic, if you take the medication and you get any sort of reaction, particularly hives or any difficulty breathing, stop the medication completely and then go see your doctor.
Okay,
and let them know that you had that reaction.
Okay, thank you.
Thank you.
All right, so what was experience like in the program?
It was good. I enjoyed it.
That's good. And did you get the correct medication?
Yes, I did.
Okay, cool. And did you have a good interaction with the screener?
Yes.
Cool. And what could have gone better?
Probably the description of the medication, to know exactly the side effects, so you know beforehand, so you're not worried later on.
Oh, okay. Good. All right. So, what advice do you have for your screener?
Probably a little bit more information.
A little more information?
Yeah, to
That's-
know a little bit more about the medication.
Okay, that's good. And do you feel that this training has better prepared the first responders in case of an event like this?
Yes.